So, contrary to popular wisdom, I think that the patients of Asian descent actually are quite good candidates. Little sting there. Okay, let's see if the next one stings. If it does, I will give you a little bit more local. Okay, that's easy to fix. And I'm going right by your eyelash margin. 1, 2, 3. Yeah, there's just going to be some hot spots, so we hit a hot spot, and I'll just try to get through them quickly so it doesn't sting. And then, for the most part, you shouldn't feel too much. And I'm protecting his lid with an eye shield here, or his eyeball. And then we're getting these zones, and that's particularly a zone a lot of people will feel is the lateral canthal line area. So what we'll do is come over and cool that if they're feeling a sting, and that helps. And then I'm taking, this is the Deep FX, that's a brand name, but the basic premise of Deep FX is that we're doing really tiny little dots that are 300 microns in diameter, so 0.3 millimeters. And for those that aren't familiar with the metric system, a millimeter is 1/25 of an inch. So, 0.3 millimeters is obviously really tiny. And that's the diameter of the little dots that are getting laid down. Each time I hit this, it hits it in a pattern that's like a little square. I can change the patterns to being circles if I'm treating it acne or other conditions that might warrant it. Little sting here, Ron. And so, contrary to popular belief, Asian descent patients are really great candidates. It's just that they commonly get post-treatment or post-inflammatory hyperpigmentation, PIH, which is very treatable. I mean, it's something that I just tell everybody to expect. I think that as long as you know the skin's going to get a little darker afterward, you're prepared. And then we use potent topical fluorinated steroids, and that works very well for our patients. That where I see it, where it's red too. This is a judgment thing, but if they're intensely red and they have type 3 or greater skin, then they need to have some topical fluorinated steroids, potent steroids, to reduce the inflammation once they're healed, and that's about 6 days from the initial treatment until people can wear makeup. So, and you might give them an extra day or two if needed, but in general we can treat. And then he's got this really kind of lumpy, bumpy nose with lots of vessels, so I'm going to really try to smooth that out. So that's Deep FX. He's got really big pore size too, so we can help. It's not 100%, but you can see the little vessels that he has. That's where typically there's very little like bleeding of any kind. Of course, there's still very little, but I'm hitting little tiny blood vessels and destroying them. This isn't perfect device, a laser for the destruction of vessels. There are better lasers that are specifically tuned to treat blood vessels, but we are destroying some of them just because the laser penetrates the vessel and that interrupts it, makes it go away. So I'm doing these with these tiny little dots of thermal energy that I'm delivering to the nose. I'm getting, sorry about that little sting, I'm getting some of these vessels. So you got a couple little stings, 2 stings in a row, and you get a little bit of local then. That's the rules. So that's numbing. And then I'm going to take, when I'm done with this, I'm going to just kind of re-prep his face with the chloroxylenol, okay? And then I can clean all this up so it's nice and smooth. It's sort of like, this would be the equivalent to like a razor shaving injury where you get a little, but the benefit is we're getting these little blood vessels too that are prominent on his nose, and that will help with those and getting better. And each one of these is working to make the little lines around the lips better. And the two areas that we do most of the deep effects are the lines around the mouth and the lines around the eye, because those are the areas where they are most prolific, first of all, and then they're most resistant around the mouth. A lot of people have gone back to full laser resurfacing, meaning the entire surface is injured with lip lines around the mouth. And I can understand why, but the recovery is so difficult that I think fractional laser still is a better choice for full face, for sure. I do plenty of chemical peels. I think those are good options, but I don't like the intense inflammation associated with full face fractional laser where the entire surface is injured. We got this little area left, the upper lip. We've done a lot of the area that is the worst in terms of aging skin. A little stingy there?
Mm-hmm.
Okay. Again, a couple hot spots, so we'll try to avoid those. And then when we get to the deep effects, which is, again, the brand name, but it's a larger spot size, 1.3 millimeters versus this one, which is 0.3 millimeters. And the depth of injury is not as great, so it's more of a scalloping injury. But so I think of this as the collagen stimulating skin remodeling pass with the deep effects. And where there's deeper lines and scars and things, I'll use this. And then with the active, we're working on the entire surface. And so those the whole face obviously gets treated with the active, and these deeper glabellar lines that he has are going to be well treated by doing those. And so at this point, I'm going to go to switch off the from this one. This is the Active FX head. I like to check the spot and make sure it's laying evenly on a little piece of wood. So this is randomly leaving those, so you can see what that looks like. It's little spots that are randomly laid down in a pattern. If I do one all by itself, it looks like that. So this, I'm going to start at the top up here, Ron. And then I'm going to move down around your eyes just like we did before. It should be pretty numb between the cooling and the block that I gave you, which is a long-term block, okay? Here, if you're going to do that, then use this and get rid of the heme. We're filming. Okay? So skin resurfacing is a way of selectively doing surface injury to the skin and stimulating a wound healing phenomenon that makes the skin better. And it's so much, it's a leap in advances over, original sanding, although sanding and dermabrasion in good hands got phenomenal results, just like deep peels do, or medium peels. Full laser, even that. But the big difference between all of those technologies and fractional is the laser beam is being laid down in tiny little dots of thermal energy, and those tiny little dots of thermal energy are distributed over an area, a pattern, if you will, that we control how much of an area there is, And I'm going to just see if it fires that way. Probably have to have Bill come check it, but it looks like it's laying down these correctly, so yeah. So I'm going to just start up here at the top, and you can tell me, Ron, if you feel anything. Hot? Mm-hmm.
Don't lift your hands up, okay?
Okay, I'm going to keep cooling, and I can do a few more little drops. There'll be little hot spots. Every once in a while you might feel a hot spot. I'll just keep it moving really quickly so it's not a sustained stinging thing, okay? So the best thing, rather than move your head, is just to squeeze that little squeeze ball if you feel it. And then if it's more than one or two, then I'll stop and give you a little more local. Because some people do this just with the straight topical, but I like the idea of having no discomfort rather than some discomfort with this. In the old days, that's how everybody did it. You just had topical numbing and like a Ativan or sometimes some pain medicine, and then they went for it. I think between the pain meds and the Ativan and the numbing and the cooling and all that stuff, we had a much better experience. So that's all done. How'd you do? I think you did well. Good. So we're just going to march it up to chic here. And then I'm going to go a second pass on the eyelid. A little sensitive there. I'm right into the temple again. So I've got this whole area, and I'd like to, my hand is set to let the pattern finish. It's complete its pattern cycle, and then I move it to the next segment, and that really makes sure that I'm getting a consistent density of little dots of thermal injury here. If on the side of his cheek here he has a couple of seborrheic keratoses, so I can kind of target those, zone in with the laser, increase the density of the laser, and really treat those completely. Although that's probably going to get most of them right there, what I'm doing. See how those patterns? Of course, if you move your hand a little bit, then you're changing it to being a lighter or less dense series of dots. So anywhere I see a little pigment, I can come back and create a little more density of thermal injury. And I'm going to do that same thing on this side, Ron, so you'll again feel this in the temple. I'll try to keep it moving quickly. And with the extra skin in front of the ear, I'm going to resurface all of it. Some people like to leave it in place, but I think you really have to, because it hits the high spots more. But the most important thing is getting these high and low spots treated. So I've gone down to his jawline, and I will extend beyond that a little bit with what I call blending. I kind of pull the laser back so that you don't really see any line of demarcation. And I just let the laser complete its pattern in each of these areas. And so that's really my hand movement. And then if I'm coming back to treat a skin lesion any place. All right, so that looks really good. And then we're going right around the mouth here. A little stingy. Right up to the vermilion border of the lip. And if we've done a good block, we won't feel very much at all. There might be a few little hot spots that everybody has, but it can be a very comfortable treatment if proper anesthesia, the oral analgesics a little bit are given, and then a little bit of relaxing medicine, and then the topical BLT medicine is given. That's a betacaine, tetracaine, and lidocaine, and then we do blocks. And what on the internet a lot of people see is a really painful experience doesn't have to be painful at all, and you can get afterward. It really doesn't hurt either. I mean, this is something that the block I did has a long-term blocking agent in it. So I'm going to do one. Oh, let me come back to that. Long-term blocking agents, that because it feels like a bit of a sunburn for about an hour after the treatment, and then after that initial hour, that goes away. And so most people have really little discomfort because the long-acting local anesthetic that I've given, in addition to the medicines, which have nice long effect, let people be pretty comfortable the first night. And then beyond that, it's really pretty easy. We just keep it moist with an ointment. When he leaves here today, he's going to have biophene, which is this white, kind of looks like Noxzema ointment on. I'm going to go over the lids now. Feel a little bit of a sting maybe. But it's like 3 pulses and we're done. Good. So we'll treat the loose skin on the eyelids too. Little stinger. Thank you, Ron. Good job. Yep, good job. And I'm going to do another pass over the glabellar lines here. And those hard areas to treat are all done. And then I want to do just a little bit of blending along his chin here. And I do that by defocusing or pulling the laser away, and then sort of angulating it in a direction that's not direct, and then we're done. It's that easy.
Exciting.
Put this on, and I'm going to take his lenses out. And then you can just gently dab that, spread it around a little bit. Yeah, so we leave it on thick. You're not trying to rub it in. This is like you're doing is good. And then I need to get a glove on here to get this. Lens out. I really hate these non-powder gloves, these nitrile gloves. I don't know why we keep buying them.
Okay.
Your hands have to be perfectly dry to get them on.
Yeah.
Okay, open your eye for me, Ron. I'm going to pop this little lens out. Same thing on this side. Good. So the lights are back on now. Let's get a little bit more here on the lids. And then this has to go right out. Open up and look above your head for a second. has to go right up to the eyelid margin, so that's where the laser goes. So wherever the laser dots go, you have to have that covered. You follow me? Any dot has to be covered. And that's true for you too. But tonight, Ron, you're just going to leave this white stuff on. It's called biothene, and it's a great promoter of wound healing. It's obnoxious as heck. It looks like Noxzema, so I don't make you wear it for a whole week or 6 days. The post effects that I have in your little post-recovery kit is much more humane and doesn't look so crazy. And so if it this can dry a little bit. So if it dries a little bit tonight, then you just add a little bit more of the post effects cream. Okay. You don't want it in his lid though. Open for me. That's a little bit thick there. Yeah. Yeah, you don't want it to be that thick there in the corner. Yes, that's fine. And then, so I'm going to give you a mirror, which is the first thing everybody wants to see. D? Everybody wants to have the mirror, like right away when they're done with the treatment. So you hand them the mirror right away. And you look like the Noxzema guy.
Very good.
Yeah, I don't know, or the Joker, I don't know, maybe. Fortunately, you won't have that, smile on you. You have a normal one.
Good.
Yeah. Or Marcel Marceau maybe is the best description. Do you remember who he is? The mime, the famous, last of the famous mimes. I don't think there are any more famous mimes. Can you hand me the chart, please? And so that's it. We've accomplished something really spectacular in that we've injured your skin surface in a controlled way in order to harness your body's wound healing power to make your skin better. Great. That's how this works, which is pretty cool.